Every single injury tells a story. But the real question is, who's actually listening? So today, we're going to dive into the incredible science of forensic pathology. It's basically the art of reading a body's clues to figure out what really happened. In this world, every single mark, every break, every bruise, it's not just a wound. It's a word and a story that absolutely needs to be told.
I mean, just think about it for a second. If an injury could talk, what would it actually say? Would it whisper about, a simple accident, or would it scream about a violent attack? This, right here, is the core question that forensic experts wrestle with every single day. They aren't just doctors, they're detectives, and the injuries themselves, they are the star witnesses.
So how do they do it? Well, the answer is always in the details. Every little thing about an injury, its shape, its size, the look of its edges, where it is on the body, all of it provides a critical piece of information. So let's jump in and start learning the fundamental language they use to decode the clues left behind.
Okay, so when it comes to any kind of physical trauma, the investigation almost always kicks off with one huge, crucial question. Was the object that caused the injury sharp or was it blunt? The answer to this one question can send an entire investigation down two totally different paths.
And you know where they look first? Right at the wound itself, specifically its edge. The appearance of a wound's edge is pretty much the single biggest clue to what kind of force was used.
Let's just compare them side by side, and you'll see exactly what I mean. A stab wound from something sharp like a knife leaves behind these really clean, smooth edges. But a laceration from blunt force, say getting hit with a pipe, it results in these irregular, torn edges. It's a perfect example of how the cause is written directly onto the body.
Now let's zoom in on that stab wound for a second. Its defining feature isn't just that it came from a sharp object. The key forensic detail is that a stab wound is deeper than it is wide. That depth-to-width ratio, it's a huge piece of the puzzle for investigators.
All right, so now let's flip the coin and talk about the other side of this, blunt force trauma. And this is a huge category of injury. We're talking about everything from a minor scrape on the surface to some truly devastating hidden dangers deep inside the body. The most common and thankfully least severe type of blunt force injury is an abrasion. Think of a scrape you'd get from falling off your bike. It's superficial, it's just your skin rubbing against a rough surface, and it doesn't really penetrate. This is kind of our baseline for understanding blunt force trauma.
But, and this is a really big but, here's where it gets serious. With blunt force, what you see on the surface is almost never the full story. A lot of the time, the most dangerous damage is completely invisible, hidden deep inside.
For instance, a really powerful blow to the abdomen might just leave a simple bruise on the skin. But on the inside, it could actually cause solid organs, like the spleen, to rupture. The spleen is super vulnerable, and an injury like that can absolutely be life-threatening. And it's not just our soft tissues that are at risk. Blunt force can do massive damage to our skeleton. A fracture dislocation is a perfect example. This isn't just a broken bone. It's a two-part injury. The bone breaks, and it gets knocked completely out of its joint. An injury this severe tells an investigator that an incredible amount of force had to be involved. So we've talked about sharp objects and blunt impacts, but what happens when the injury isn't from a quick hit or a slice? Let's look at a different type of trauma, where it's all about sustained, overwhelming pressure. In these cases, the force itself is the weapon.
Well, that brings us to a really serious condition called traumatic asphyxia. This is what happens when there's so much intense compression on the chest that the lungs just physically cannot expand to breathe. It's a truly terrifying way to die.
The process itself is a devastatingly simple chain of events. First, you have intense pressure on the chest. That makes it impossible for the lungs to inflate and take air. And because of that, the body's oxygen supply is completely cut off, which leads to death. It's a very direct, three-step path to a fatal outcome.
So after all this, you might be wondering, why do all these specific classifications matter so much? Well, for investigators, terms like stab wound or traumatic asphyxia aren't just medical jargon. They're the fundamental building blocks they need to accurately piece together exactly what happened.
Look, if you remember anything from this, let it be these 4 rules from the forensic playbook. Clean edges mean a sharp object. Torn edges mean a blunt object. Remember that blunt force can cause everything from surface scrapes to deadly internal damage. And finally, that fatal trauma can come from sustained pressure, not just a sudden impact. All of this just goes to show how much a body can tell us if we just know how to listen.
And that really leaves us with one final big question. What other secrets about life and death can this incredible science of pathology still unlock?